Michigan Department of Civil Rights is taking an in-depth look at the impact of discrimination on health at its annual summit on June 27th. The sessions are going to examine how bias can result in some very real issues that affect a person's well-being, such as stress and a lack of access to health and social resources. In addition to raising awareness of the problem, experts are going to offer best practices for dealing with the health issues that arise from discrimination. I got more details on the Civil Rights Summit from the department's executive director, John Johnson Jr. So I want to start in a little bit of an unusual place for this conversation. We're talking about a health summit here in the state of Michigan, and you are the executive director of the Michigan Department of Civil Rights. I want to spend just a little time talking about the connection between civil rights and health issues. I'm not sure everyone always makes that connection.
Absolutely. Thank you. Well, as you indicated, the Michigan Department of Civil Rights is involved in health issues. We are the civil rights enforcement agency for this state. We're charged with enforcing the Elliott Larson Civil Rights Act and the Persons with Disabilities Civil Rights Act. And certainly we receive complaints and then we investigate them, and then we try to facilitate them if we find there's discrimination, or ultimately perhaps to bring a charge. Health issues are one of the obviously complaints that we receive. They could fall in a number of areas. It could be certainly because of health care, or could be even of environmental justice, housing issues. So people can assert their rights in terms of they think they've been the victim of discrimination because of their race, religion, national origin, etc. Then we certainly would take that and pursue that. We also look at DEI issues, diversity, inclusion, and equity issues. And health equity, certainly one of the issues that we've been dealing with for a while. We had a summit last year, and we dealt with the isms being and how they intersect, the racism, ableism, classism, sexism. And one of the issues that we dealt with was health. Yeah. We also dealt with other issues such as education and economics and voting and housing. But we did deal with health issues also. So this is sort of like an extension of that. We talked about health equity issues during that conference. Now we're going to sort of expand on that by examining the impact of discrimination in the health area. We're looking at a number of areas in that area to deal with, again, protected classes, of which we're, again, charged with making sure that we enforce their rights under the civil rights laws that I mentioned, and how they're affected, again, by health disparities and health inequities.
And let's talk about what some of that looks like, essentially the outcomes that look different because of the discrimination in health access and health care up front.
Right. Well, we'll be exploring a number of areas. One of them is environmental justice and health. We're starting to look at how segregation and redlining and food security and all that have contributed to inadequate health opportunities for those living in certain areas. We're looking at the LGBTQ community in regards to health issues and how we look at health issues from a more equitable fashion in regards to that community. Social determinants, looking at this at the systems that exist that contribute to health and inequities. I mentioned some earlier in terms of housing, but also the educational system. Looking at disability in terms of how access to technology and a recognition of how, again, there's discrimination in the healthcare industry in regards to those with disabilities. There was a great number of work, a lot of work done by Lieutenant Governor Garland Gilchrist's COVID-19 Racial Disparities Task Force. We've invited him to come and speak along with Tommy Stallworth, former Rep Tommy Stallworth, who headed up that task force, talk about their findings, some of the things that we need to do in order to implement those policies. And finally, a fascinating look at housing and the effect of this redlining discrimination on health in the housing industry. We're certainly, and that's a teaser for something we'd like to do a little later in terms of exploring discrimination in the housing industry. This is focused on health, and we'll be hearing from Dr. Mehdipanah out of University of Michigan, who will be talking about her data that links redlining and discrimination to health inequities. And that's kind of teaser to a longer conversation we'll have later on about mortgage lending and discrimination in the housing industry. So there's a connection. All these involve civil rights enjoyed by our citizens. We'll be exploring some of these aspects during our summit.
Yeah. And when you have a summit like this, which is, presenting information and allowing for discussion about these things, what are some of the things that you look for as outcomes from the summit itself? Things that you hope to be different or even possible, I suppose, because of the focus on this.
Exactly. And you're actually correct. We come together not only to discuss these issues, but to come up with strategies to actually try to remedy them. Some of the outcomes of last year's summit, by the way, will be a couple of things. We'll be launching a voting rights project. One of the recommendations from that summit was a capture some of the real life inequities we see in the voting process, and to capture those in a compelling, sort of interesting way. We'll be launching a media campaign that voting is a civil right, and we'll be focusing on that along with voter education. That came out of the Voting Rights Summit. Again, this health is another one, looking at this health summit. So, and one of the strategies that we have will be coming out looking at policy, because we know that's what moves everything, public policy. Certainly, we receive complaints of discrimination, but it's the lawmakers that certainly, and our executive branch, certainly that initiates and passes public policy that affect these changes. And that's really the goal, is to bring this to attention and then to come up with strategies that we could do in order to affect public policy.
Yeah. So when you think about Michigan, and you just mentioned lawmakers, the legislature, their role in this, the executive branch, the governor and the lieutenant governor, their role in all this. Tell me about some things that you see as possibilities and I guess hopeful possibilities because of the folks who occupy those seats right now, and then tell me about some challenges that you see that maybe worry you.
Yeah. Well, certainly we've already witnessed this couple of the change, the expansion of the Illinois Larson Civil Rights Act, which there'll be two new protected classes, one for sexual orientation, the other for gender expression and identity. That will take effect right now, scheduled for March. So that's an immediate impact. Now, mind you that the Civil Rights Commission issued an interpretive statement back in 2018 saying the same thing, which is upheld by the courts, the Supreme Court. And now this has been codified. So now we look at that as a significant change in certainly what's happened. There's other things that are brewing in the legislature in terms of they've also changed it so that now non-therapeutic abortions, you cannot be the victim of discrimination based on that. We'll also see some other changes that perhaps they've advanced that I think will strengthen civil rights enforcement and rights here in Michigan. So that's a positive. Some of the things I think that probably, and also I think there's been legislation will be introduced that will strengthen our hate laws. Right now, they're not as strong as they could be, and efforts afoot in order to strengthen those so that it broadens the categories in which the law enforcement can go after people who conduct hate crimes. Some problems that we see, but certainly always when we look at change, that people sometimes are resistant to that. And we recognize that just because these laws have been passed doesn't mean that people automatically will fall lockstep into what has been done. We've seen that over the years. Laws have been passed to change policy, but it's a culture change that we need. And that's some of the role of civil rights in terms of not only enforcing the law, but going out and conducting implicit bias, culture competency, ADA training, sort of educational work that's needed in order to change minds and change cultures. Folks have to look at themselves, have to look at whether or not they're really being inclusive in their policies. We're happy to help them in terms of looking at their policies, because sometimes you look at obviously items with filters. The more people at the table, the better we are in terms of looking at change in policies and reformation. And that's where I see the effort really being sort of difficult is change. That's always difficult, especially cultural change. But I'm optimistic because we see what's happening in the legislature, and we see a society that's embracing change at a rapid pace. So that makes it very hopeful that we see that change will once again flow through most of our society as the years go on.
Yeah. Okay, John Johnson Jr., congratulations on holding another summit on June 27th, and we look forward to what comes out of that. Thanks for joining us on
just want to emphasize, it's at Suburban Collection Showplace. People can sign up by going to our website, michigan.gov/MDCR. It's free, open to the public, 8:30 to 4. Everyone's invited to be a part of this summit. Thank you so much for your time, Stephen. We appreciate that.